Hey everyone, welcome back to Med Insights with Rahul. Have you ever wondered why you or someone you know doesn't seem to get good night's sleep? It could be more than just stress or a busy mind. It could be a sleep apnea. Sleep apnea is a serious sleep disorder that affects millions of people worldwide. It's not just about snoring, it's about your body not getting enough oxygen while you sleep. So today we are diving deep into what is sleep apnea, its causes, symptoms, and how it can be treated. So let's get started. One of my dearest friend has this condition. He could not sleep properly during the nights and had excessive day drowsiness. So he went to his professors and they recommended him to undergo polysomnography, a comprehensive sleep study.
Sleep apnea comes from the Greek word apnea, meaning without breath. It literally means you stop breathing for short periods while you are asleep. But how common is it in India? Studies have found that the prevalence of obstructive sleep apnea in the general adult population ranges from 3.7% to 21%.
There are three main types of sleep apnea. The most common one is obstructive sleep apnea or the OSA, where the muscles of the throat intermittently relaxes and blocks the airway during sleep.
The second type is central sleep apnea or CSA. Is less common and occurs when your brain doesn't send the proper signals to the muscles that control breathing. And there is a complex sleep apnea syndrome, a combination of both OSA and CSA. Each type has unique characteristics, but all disrupt your sleep and can lead to serious health issues.
So how do you know if you have sleep apnea? The common symptoms include
loud snoring, gasping of air during sleep, waking up with dry mouth, morning headaches, insomnia, and daytime sleepiness. For children, the signs can be different: bedwetting, hyperactivity, and poor performance in school.
Several factors can increase the risk of developing sleep apnea.
Being overweight is a major risk factor. Extra fat can obstruct the airway. Neck circumference also plays a role. A thicker neck can narrow the airway.
Other risk factors include
a narrowed airway, being male, being older, having a family history of sleep apnea, using alcohol or sedatives, smoking and nasal congestion. Certain medical conditions like hypothyroidism can also contribute.
Diagnosing sleep apnea involves sleep study, also known as polysomnography.
During this study, you will be monitored overnight to track your breathing patterns, heart rate, and oxygen levels. For those who prefer staying at home, there are home sleep apnea tests. These are simpler but still effective at diagnosing sleep apnea. Your doctor will also review your medical history and perform a physical exam. Sleep apnea isn't just about losing sleep. It can lead to serious health problems. Daytime fatigue and sleepiness can affect your daily life, making it hard to concentrate or stay awake during activities. It also increases the risk of high blood pressure, heart attack, stroke, and other cardiovascular issues. There is a link between sleep apnea and metabolic disorders like diabetes, and it can even contribute to mental health problems like depression.
Fortunately, there are several treatment options for sleep apnea. Lifestyle changes such as
losing weight, exercising, and avoiding alcohol and smoking can make a big difference.
One of the most effective treatment is continuous positive airway pressure or CPAP. Let's watch a very short video on CPAP machine, and this video credits goes to my friend.
Okay, so this is a CPAP machine made by the company ResMed. There are many other companies such as Philips and BMC and many others who make similar products. So the cost varies from 30 to 60K. This is the water. This is the water tank, which is used with the CPAP machine to keep the passage and the pipes warm and boiled. This is the pipe, which is used to connect the CPAP machine to your mask. It fits two ways. One end fits at the CPAP machine, and the other end fits to your mask. And lastly, this is the power sword, which is used.
A CPAP machine uses a hose connected to a mask or nose piece to deliver constant and steady air pressure, keeping your airway open. CPAP machines are costly but can be rented. CPAP is preferred for obstructive sleep apnea.
For central sleep apnea, bi-level positive airway pressure or BiPAP machines are preferred.
There are other breathing devices too, like ASV, which can be alternatives if CPAP isn't suitable. In some cases, surgery might be an option, such as vulvopalatalopharyngoplasty or Inspire therapy, which involves a small device implanted in your chest to stimulate airway muscles. Understanding its symptoms, causes, and treatments can help you take control of your health. If you suspect you or your loved one has sleep apnea, consult a healthcare professional. It's also important to consult an ENT doctor if you notice any symptoms, as they can provide a comprehensive evaluation and guidance.
Thank you for watching, and don't forget to like, share and subscribe for more health related content. And remember, a good night's sleep is essential for your overall health. Stay healthy and see you in next video.